So Troy, tell me where we're up to with Steve.
Okay, last week I went out on a home visit with him, just to see how he's travelling along. And when I was there, I talked to his grandmother Bronwyn about the case plan meeting coming up and the fact that we need to do 149 beta K assessment to find out who we should be inviting to that case plan meeting. And she talked to me about, because we don't have one in place at the moment, and she talked to me about, she was talking to another carer, so she knew a little bit about it, and I tried to explain it to her the best I could, but she got really, I guess, antsy about it all. And as you know, like there's a relationship kind of breakdown between Bronwyn and her daughter, Steve's mum, so yeah, she wasn't really keen on what information we could give to Steve's mum and share about him and who we could invite to the case plan meeting. So I'm kind of stuck. I don't know which way to go with it.
So I guess the first thing that we need to think about is the 149 beta K risk assessment is around what risk it is to Steve for his parents to have high level information. So it's really important that you speak to Bronwyn about what risk she thinks it would be for them to have that information. I understand they don't get on, but that's not enough information to suggest that Steve would be at any risk with his parents knowing such things as what school he goes to.
Okay.
So just really making sure that she knows that we have an obligation under the Act that we have to provide information to parents unless it poses a risk to Steve. So you really need to have those conversations with Bronwyn about letting you know what those risks are if she thinks, not just she doesn't like them.
Okay, that makes more sense because I wasn't too sure which way we go about it, and I thought it was more around, I guess, protecting the carer's information more than protecting Steve. So that actually frames it a bit better for me, I guess, and I probably should look through it a bit more.
And then we also need to talk to Steve. He's 14 now, so you need to get his views. And then we can speak to the parents as well around what their views are, what information they want and what they would be happy with. And then we can form our rationale as to what type of information we're giving. If it's high level information, unless there's a risk to Steve.
Well, that does remind me, actually. There was something, I think, that happened some time ago where Steve's parents they were at school, I think, apparently, across the road from the school, and they may have been intoxicated and trying to call out to him or something, but I'm not too familiar with that. It's just, it was something that I think I read somewhere, or maybe the caseworker in the handover mentioned to me previously for Steve.
So I guess it's having those conversations with mum and dad again around that and what that information means. If we're providing that information, what that means for them. And also to having the conversations with Steve and Bronwyn again. And just really letting them know what the assessment is. It's an assessment of the risk to Steve.
Okay, because I guess that was some of the questions that Bronwyn had as well around, she was concerned about their drinking and drug habits. So that does make a lot of sense that, if that has happened in the past, that's probably where her anxiety is coming from a little bit.
Of course. Okay,
Okay, excellent. I'll work on that then.
Great.
Thank you.
Thanks, Troy.